All right. Today, you guys, we have Dr. Katie Woodley. She is a holistic veterinarian and visionary behind the Natural Pet Doctor. I'm sure you guys have seen her social media stuff all over. It's pretty awesome. She is fervently devoted to weaving Eastern traditions and Western practices together. Her drive stems from her personal experience witnessing firsthand the gaps in the medical system when her husband battled an autoimmune issue. And I can't wait to hear more about that. I think many of us have also been in the same stream of medical practices and falling through the cracks there. So now her mission, that just made her mission crystal clear, and ensuring pet parents that there is a new, holistic, possibly better pathway. Dr. Katie, thank you for joining us today. I can't wait to see what you have for us.
Yeah, thanks so much for having me on. And I know there's a couple people here. I won't be able to, I don't think I can see the chat. I can't see the Facebook group, but super excited to be here and share about hair tissue mineral analysis testing because it's not really commonly done, but it's kind of changed how we get results in my practice and how we dive deeper into finding root causes, which is what I'm all about. I'm always asking why. Why is this here? Why is this symptom happening? Why are we using that supplement? Why are we using that food? That's something you'll hear me talk a lot about online. So thank you, Poppy, for inviting me on.
It's such a pleasure. I got to meet Dr. Katie in person, you guys, at the Thriving Pet Expo, and her smile lights up the room first. It's like she's just beautiful. And then her presentation was beautiful, but she has this talent for acting, you guys. That is hilarious. And so Carrie Hines had these skits, which were really, really smart, is how to approach your veterinarian with these tougher questions. It was brilliant, actually. And Dr. Katie was the veterinarian. Um, she was hilarious on her conventional reactions. She took it to a new level. She actually walked out in a hazmat suit when somebody said they were feeding their dog raw. So anyway, I still chuckle over that, and I actually have the video of that. I could probably put it in the group. Um, so yes, and if you guys want to hop on Zoom, I put the Zoom link in there, but for some reason it only came up halfway through. So I don't understand what happened there. If you guys have the Zoom link, if you can share it on the Facebook Live,
It was
that
right there. That's how I got in.
I know it's super strange when I like tagged it to go live, it just cut it off in half. So I don't know. You guys, if you want to join live, feel free to do so. And if you don't worry about it. Watch from here. So thank you, Julie, Jen, Debbie. Thank you for being here. So what do you have for us, Dr. Katie? I'm gonna like remove myself from your screen
Okay,
and you can
perfect.
chat away.
Perfect. So what I'm going to do is I'm going to share my screen
I might
and
make you a co-host.
yeah,
Let's see if you can do that. I'm gonna have to do it this way, aren't I? There you go.
there we go. Perfect.
You
And I'm
are.
going to have Poppy, I'll have you tell me if I'm going to share this and then I'm going to start it in presenter view. I want to make sure it doesn't stay in presenter view. Sometimes it gets funky. So do you see
I see it, and it's in now.
presenter view?
It's starting to look like a presentation. You've got a huge side note.
Yes,
So
I'm in it. Let me swap. Here we go. Now it should do. There we go. Is that look good?
it's awesome.
Okay, perfect. So what we're going to do, and this is something where for everyone here who's, I know there's only a few people that are here live on the Zoom. This is something where this is going to be a higher level overview of the hair tissue mineral analysis test. I like asking people questions to get an idea of where you're at so that I can also kind of gear it to you. But what I'm going to do is I'm going to go through this and share some case studies. Feel free to post your questions in that chat box and the answers to some of the questions that I have at the start. And then, of course, at the end, I'm sure there'll be some questions, but I'd love to answer that because this test, as I mentioned, isn't very well known about and it's not commonly done. And it has literally changed my entire practice and the results that I get. So we're going to talk about how we really unlock health at the cellular level. And for everyone here live, if you can drop in the chat, who here has heard of a hair tissue mineral analysis or even done it for your pets? You can just drop that in the chat if you can. That just gives me an idea of how familiar you are with this. And if you're in a place to do that. So that'll
So
be helpful.
I have had clients do it, and
Yep.
Jen has on Facebook. And it's been really confusing for me, Dr. Katie. And this is
Yep.
one of the reasons why I really wanted you to come on, because I do a lot of detoxes and it was
Yes.
for some horse clients. And so I didn't know if the hair sample was actually valid because we were purging that stuff.
Okay, perfect. That's great to know. So I'm going to share, we're not going to, at the end of this, you're obviously not going to be an expert in this. There's a lot to it and the connections and the correlations, all the relationships with the vitamins, minerals. But I'm going to show you where I used it in a lot of cases where it looked like it was something else. And then it was actually something deeper that we had to resolve. And then we'll go from there. So Janice done it for myself, not my animals yet. Perfect. Thank you for sharing that. All right. So what I'm going to cover is we're going to do this broad overview of what are hair tissue mineral analysis tests for people that may not have any idea what it is, why it's important, how to kind of go about interpreting it. There are a lot of different companies out there. There are pros and cons, which can also make it more confusing sometimes or better understood depending on the company you're using. I'm going to go through a couple of patients, so case studies, so you can get an idea of how it's helped me as a practitioner and the pet parent, and then some key principles for a healthy pet, of course, because I'm not doing my job if I don't give you some tools that you can utilize right away. And then we'll go through any questions that anyone has. But who am I if you're not familiar with me as Dr. Katie Woodley? I've been on quite the journey of personal development, growth, lots of health learning lessons that have brought me to where I am. And it kind of the pictures start from the far left where I'm feeding our little lammies in New Zealand. I went to vet school in New Zealand and we lived on a lifestyle property. We raised our own animals. We grew our own food. It was beautiful. It was amazing. You're like, why did you move back? My student loans were in US money. It didn't help. So that was a big thing. But my husband, who I met in New Zealand, he is from New Zealand. He is not a veterinarian. We lived together on this property. When we moved back to the States, 6 months after moving back, I was a new graduate, fresh out of school, ready to vaccinate your animals and feed them kibble. I was that veterinarian. I didn't know better. And I thought I was doing the best that I could with the knowledge that I had. However, 6 months in, so I was about probably a year and a half, almost 2 years into being a veterinarian, this is where my husband got sick. He actually developed an autoimmune disease, inflammatory bowel disease, ulcerative colitis. If anyone has ever experienced any of that, it changes your life. We are very active, and that just chopped it right out. There was a point where he actually almost died. This is him actually in the hospital. You can see him there. He is not dead. He ruptured his appendix, and then he was put on IV antacids, IV antibiotics. They tried to feed him for his first meal with IBD coffee and ice cream with milk. And thank goodness that I knew better. I knew a little bit more or a little bit less than I know now, but I was able to make him broths and healing foods, and we got him out of the hospital. 2 weeks later, he dropped about 40 pounds. You can tell in that picture, in these pictures, my husband is not super like big. He doesn't have a lot of extra weight to lose. And he almost died. And I was his advocate for him in that situation, just like so many pet parents here are the advocate for their pets. When you go to the veterinarian and your veterinarian is doing the best that they can, but they may not know better. And he actually had Clostridium difficile, and I had to ask for the test. And then I actually had to start the treatment for him. which is absolutely crazy, right?
Wait,
We
you're
were
kidding me. He had C.
insane.
diff and they didn't even, did they
They
not?
thought it was a flare up and they wanted to put him on steroids. So we went in and out of the ER. We were there 3 times and it was on a holiday weekend each time. So it was Memorial Day, July 4th. And then I actually ended up using antibiotics for him specific for C. diff. Now there's lots of different types of herbs and things that I know that can help that I use for my clients. But at that point, this is about 7 or 8 years ago, he would have died. They weren't going to test. They kept saying, you just need to listen to us. And I said, you need to do the test for this because this doesn't feel right. There's something off. And this is like, when I hear that from pet parents, it goes right back to this for me. And unfortunately, part of my journey, because of his situation, this is why I became acupuncture certified, Chinese herbal medicine certified, food therapy is a huge part of my practice also now. And then when we fast forward a couple years, I lost these 2 beautiful kitties to aggressive GI lymphoma and my soul dog Finn there to a brain tumor. However, the difference with Finn when he was diagnosed was that I actually had the tools in my toolbox. The neurologist told me that we had a week left for him to live. He had severe brain swelling on the CT scan. He was having seizures. He wouldn't eat. He couldn't walk because of the seizure medications. The steroids gave him diarrhea. He was vomiting. This dog had never missed a meal in his life. And they said, take him home and love on him. And I said, I'm going to do that. And I'm going to do the things that I know what I need to do. And we gained another year of amazing quality of life for him. So this is why it's so important that everyone's here to like stay on this journey. There are so many ups and downs. And as veterinarians, we go through a lot of this. And it truly brings back why this mission is so important that, especially me, I keep going to share this information for pet parents like yourself, but continue to be that best advocate. It is okay to ask those questions and to say, no, thank you. I need to do the research or I want to look into this because of this very reason. So I've been through the ringer personally with my own pets, but I'm grateful for every second of it because it's led me to where I am today. So I just wanted to share that because I don't talk about my husband, but I don't talk about a lot of the struggles and challenges we've been through and with our own pets. And it's really, really important because I've been right there too, which I know so many pet parents are there. So I hope that kind of helped share, like, you're not alone in this. And what you are doing is really, really important because at the end of the day, all we have are ourselves and being our best advocates for ourselves, our family members, and that includes the furry ones and the non-furry ones. So my husband's doing really well today because of what we've done and the knowledge and research that we've done. I've been told by gastroenterologists food does not matter. So things like that where I'm like, huh, interesting. Thank you for your opinion. On to the next, right? So that's just a little bit about me of why this topic's really important. I know it has nothing to do with hair tissue tests, but it kind of does. So I want to talk about what is a hair tissue mineral analysis test. This test has actually been around for a really long time. It's been around about 30 years. So it's done in humans also. I've actually done some for myself, my husband, my family members. Very fascinating test. Highly recommend it. And now it's a simple non-invasive test. All we're doing is collecting a fur sample as close to the skin, and it's going to help us determine objectively how the body's absorbing and using nutrients from the food and environment by using the fur. And we can also determine if heavy metals might be a concern. This is a huge issue right now. Small thing going on with a big pet food company and some other brands. And there's possibly a huge concern around heavy metals, but now we have a test where we can actually assess and look for them. And then it's also going to look at how well the hormonal system, so adrenal glands, thyroid, pituitary gland, hypothalamus in the brain, which are really important for a lot of parts of the body working together, and the nervous system, how well are they working? And we can really look at the nutritional levels at a cellular health level, really different from a blood test. So what does hair show us? And I love this picture because it's so complex. You know, it's not just this like dead hair. there's a story to it. And hairs form from these clusters of matrix cells that make up the follicles. So during the growth phase, hair is exposed to the internal metabolic environment. So this is where we have all these circulating fluids bathing that hair cell, the circulating lymph, the blood, extracellular fluids. And as that hair continues to grow and it reaches the surface of the skin, this is where those outer layers harden. So that cuticle forms and it locks in the metabolic products that actually accumulated during that period of formation. So when you look at this, if you can see my air, which I think you can, so we've got so much going on down here. All those cells are bathing this hair follicle. So that cutin is forming. That's what's up here. So when we take a hair sample, we're actually removing it right at the skin layer. And we're going to get about 3 months worth of cellular health status, which is pretty impressive. Now, how do minerals work? It's pretty complex. There's over 70 known mineral interrelationships. I love this mineral wheel. It's pretty crazy, right? They're all interconnected. They're all interdependent on one another. We can't alter one without affecting one or all of the others. That's really, really important. Unfortunately, conventional medicine is kind of like a pill for every ill is a common saying that we use. But what's happened is that when we look at these test results or when we see certain things, and this happens with like microbiome tests, I find too, if something's off, we want to replace it. Or if it's deficient, we want to add something in. But there's this complex relationship we have to be very careful about in the body, because if we add something in, say zinc is low, and we start adding in more zinc, it can interact with other things like copper, magnesium, calcium, sodium. So this wheel here shows and displays that beautiful interrelationship with a lot of these minerals. Now, there's different companies out there. The company that I use is Analytic Research Laboratory, so ARL. They don't wash the fur sample, which is really important because that can kind of skew the results that you get. They run both people and also pets. So this is the company that I was trained under with Dr. Ava Frick as my mentor. And so the graphs that I'm going to show you are the graphs that I use when I create the reports for my clients. So I'm going to use these. Some of the graphs that you may have seen if you've used other companies might look a little bit differently, but what they're looking at essentially is both disease trends, and we're really studying for like the stress. How is the body physiologically coping? What are those mechanisms? And once again, it's looking at that it's essentially a soft tissue mineral biopsy, non-invasive. We're taking that first sample, but it's looking at the cellular health level for the past 2 to 3 months. And it's going to allow us really for improved recommendations for vitamin and mineral supplementation. Now, why are these so important? I want you to look at these 3 pictures. These are really common presentations that I deal with. I deal with a lot of gut and skin issues, but of course there can be lameness. And what happens is a lot of times we end up reaching for the wrong things because we're treating a symptom. So itchiness, we think it's allergies, but how do we know it's not a heavy metal problem? How do we know it's not a zinc deficiency, which is really important for not only the gut health lining, but also the skin? How do we know it's not a vitamin E issue? Now, we're not testing vitamin E, but we can get a better idea of levels of inflammation in the body. With pain, how do we know it's not a heavy metal problem? With gut health issues, how do we know there's not an excess in some vitamin or mineral or inflammation problem, a detox problem? So this is why this is so important, because a lot of times we're guessing. And I always say test, don't guess. Now I know not everyone can access these, but this is why I love hair tissue mineral analysis tests, because we take the fur sample and send it to the lab. We do hair samples from pet parents all across the world because it's so easy to collect and there's no issues with customs usually. So it's a very easy test to run that can give you a lot of information. And once again, you know, the nutrition matters, but it's not the only part of the story. And it shows us the different stages of stress. Stress is such a big component of health nowadays with what we've been through in the world, our own emotional health. And we can actually look at what different stages of stress there are. And we can see zinc and magnesium are lost when we're in that first stage, that acute stage of stress. When we start getting into like, okay, the stress is not ending, we're kind of going into this resistance stage of stress, calcium and copper can be lost. And then when we get into exhaustive stage of stress, so the term a lot of times that's used is adrenal fatigue, adrenal insufficiency, like your adrenals are just like, they're done. This is where we see loss of sodium and potassium. Now, malabsorption, so if the gut's not working well, there's things off with the microbiome, digestive enzymes, stomach acid that will impact how we're breaking down the food and absorbing specific minerals and nutrients. And excesses or deficiencies, as I mentioned on the last slide, can actually show up as symptoms. So copper toxicity, heavy metals can actually look like allergies. And calcium and magnesium deficiencies can show up as behavior issues. So I have a lot of pet parents come to me and they're like, my dog's so reactive. Or there's a sudden change or a gradual change too as they get older. And they're like, why are they reacting? I like drop something and they jump halfway across the room. And I'm like, there could be a calcium magnesium deficiency. These are the tranquilizing minerals. Toxins, we live in a toxic world. We're surrounded by toxins every single day. We are producing toxins internally too through metabolic pathways, mitochondrial health, and we tend to forget that. But the external toxins also, like herbicides and glyphosates, they can act as endocrine disruptors and they can affect those hormones that influence nutrients. They can also bind to nutrients and they can accumulate in those adrenal glands, which impairs the health of our pets and ourselves. So once again, this is just a really awesome test at looking at a snapshot of the cellular health over the past 2 to 3 months. Now, everyday life challenges, I just wanted to remind everyone what we're coming up against, right? Since you may not need the reminder, but vaccines, we're exposed to potentially 85,000 toxins yearly. There's chemicals and toxins that are in the food potentially that are in the water. The genetics also, we can have sluggish detox pathways. We don't have a lot of the technology or tools or tests that we do on the human side, but of course it would play a part in our pets as it does in humans. Environmental stressors, routine preventatives, so things like flea and tick products, medications, emotional stress, and physical health stress. And so once again, those signs of disease, those runny red eyes, respiratory issues, slowing down, low energy, GI upset, itchy skin, coat concerns, behavior problems or changes. If your pet's obese and you can't get weight off of them, there could be a toxicity issue and even lameness. Now, what do? We throw darts at the wall. We hope we hit that bullseye. And a lot of times, once again, we're guessing and we don't end up hitting that bullseye. And then what happens? We go through the supplement graveyard is what I like to call it, where we start having all these supplements that we're grabbing, we're trying, we're spending all this money. You might be going back and forth to the vet for the same problem. It might go away for a little bit and then it comes back. And this is why that's happening, because we're missing the root cause. And keep in mind, symptoms are not the first manifestation of a problem. They're the last straw when the body can't compensate further. So we're on a spectrum of disease, which I'm going to show in a little bit, where we're constantly moving from more inflammation, less inflammation, stress then moves us more towards symptom expression. And so keep that in mind. When we see a symptom, it means the body can't take anymore. And I talk about the foundations. We need to remember that. Think about your body, your pet's body as a house. We want a nice solid foundation. But what happens is we start seeing a crack in the wall. So think of this like a symptom. We're like, why is that crack there? We start plastering over the crack and we're like, great, that should fix it. The next thing we know, the crack is back or there's a new crack. And we're like, what happened? And at the end of the day, we forgot to look at the foundations of health, essentially. And that foundation may be sunken, and that crack in the wall was just a symptom. So if we're coating over it by just using supplements, hoping that it works, we might actually miss the root cause. And another great analogy, which really helps bring home that concept, is when I think about like a forest fire. We can put out the flames in the trees up above, but a lot of times that fire is still burning underneath in the underbrush. And all it takes is a wind to come across and that fire picks up again. And so our bodies are exactly like this. If we're not finding why is there chronic inflammation, whether it's heavy metals or a stressor, or we're having a problem digesting, or there's a lot of different reasons, then if we end up with a little bit more stress, so boarding, travel, a change in the family, we change the diet, all of a sudden we can't take it anymore. And it's like a wind coming through and the flames flare up. And then we see the things like the ear infections, the hot spots, the diarrhea. So keep that in mind when you're thinking about why is this happening? What is going on in my pet? And once again, this is really important because I didn't know better. And I did the best that I could. And I've resolved a lot of guilt around that with my own pets, my Stanley, my Callie, my 2 kitties there, and with Finn. But when we start looking at the body very differently and we start asking better questions, we get much different results and much better results. So once again, why a hair tissue test? Hair is like the key to uncovering what's deeper in that body. It's going to detect mineral deficiencies, once again, looking at energy stress levels, and it's going to show trends. And it can really provide that guide to what supplements do we use? What specific nutritional recommendations? What is going to help put this body back into balance? And one of the things that I always get asked about too when pet parents receive the reports is, well, the blood test didn't show anything. And this is something to keep in mind. These are very different tests. So when we're looking at blood tests are like looking at blood is like the highway for the body, for the mineral and the vitamins to move to and fro from the storage areas. It's the extracellular. And so the blood has to maintain homeostasis or balance, and it doesn't show changes until we have some pretty significant changes going on, and usually we're pretty depleted at the tissue level. So the blood's going to borrow those nutrients from cells and tissues to maintain homeostasis in the blood. So I look at blood when I'm interpreting what are those blood test results, because it gives us information. But I can tell you with my 3 pets with cancer, their blood was completely normal. And we knew they had cancer at that point. So this is why this test is really helpful at, once again, uncovering that deeper level where things can be off. And this is why it's not just like for chronic health issues. Yes, I use it all the time and it helps illuminate where we might have some deficiencies or excesses or imbalances so we can repair it. So with allergies, skin ear issues, gut health issues, behavior problems, endocrine, hormonal problems, thyroid disease, chronic kidney disease, any health condition, this is a great test to do. But it can also be used as a proactive wellness test. So I would say once a year, run these tests, get an idea, because once again, symptoms do not show up until the body can't handle it anymore. So if we can take that proactive approach that every single person here wants, and why you're probably here learning, use this test as part of that proactive wellness approach. So let's talk about interpreting. Once again, I'm not going to go through every single step because we'd be here probably for a couple weeks. And there's a lot to it. But I want you to come away knowing these hair tissue tests, they're not standalone diagnoses, but they're going to provide you with essential information and some tools that you can start working with what supplements we use. So we don't end up with a supplement graveyard. And you need to use a practitioner that's trained in hair tissue mineral analysis testing. It is a very complex thing. There's over 70 interrelationships with those minerals. There's the heavy metals. It's understanding at a deeper root level the physiology and how everything is interconnected. So share these results with your vet, because when I learned about this a couple years ago, I was like, this is the coolest thing. And then I went down the path of learning how to do it. And once again, it's changed the results that we see, gives me another layer of information that I can use to help heal my patients. It's also going to help you figure out what types of foods that your pet does best with, because there's different forms of oxidizers and how they metabolize their energy. And then also to the heavy metal significance. Is detoxification a huge area where we need to focus and things are all clogged up? Or is it, okay, yes, we need to support that area as we always do, but it's not the main reason why we're here with the health issues that we have. And then also too, keeping in mind those vitamin mineral interactions. I've listed a couple here. Vitamin C is going to impact iron. It can reduce copper retention. Copper and zinc have inverse relationships with each other. Sodium levels relate to adrenal stress and inflammation. That freaks everyone out. You're going to see in these 3 case studies I have, sodium elevates for a lot of pets because the adrenals take the big hit. That's the stress. And that can also be indicative of inflammation in the body. But I want to also point out, I mentioned the vitamin C because there's been this thing around copper. Obviously, there's more to it than if we have a copper issue and we're feeding processed pet foods like kibble or synthetic vitamins and minerals. I always say move away from those first. But vitamin C is very powerful at helping to lower excess copper levels. Keeping in mind, when we do that, it will impact the other vitamins and minerals naturally. So that's why it's really important to work with a practitioner that understands how they all interrelate. Now, Roper's a 10-year-old neutered male Australian Shepherd that came to me because he just had this back pain that no one could figure out why it was happening. He had some behavioral issues. He was kind of acting a bit crazy. Yes, he's an Australian Shepherd. He was getting exercise. So it wasn't that he was just, locked up inside and not displaying his natural instincts. And he also had a really dry coat. But he had been on a raw diet his entire life. He had been receiving chiropractic adjustments for a year every single week. It was crazy. And none of the treatments were holding. So she had done all this diagnostic testing, blood work. I'll touch on that just a little bit in the next slide. But however, nothing was working and they couldn't figure out what the cause was. And so, of course, we did a full physical exam. I did a lot of testing. Hair tissue mineral analysis tests were one of these. And this is what his first tests look like. So this is literally the report I get that I then turn into like a 16 page report for pet parents, because it's confusing, right? You're like, well, we should supplement the low things and we need to reduce the high things. And what are those ratios? So it is a very complex test. But I highlighted a couple things that are very common when we look at hair tissue tests. And what I saw immediately was a huge factor for Roper not responding to what his mother was doing. I want to see, can you see my cursor there? That aluminum under toxic metals is 44. We should be less than 3.2. It's like, holy smokes, this is bad. That's no good. The other things too, so we never take anything in isolation. Remember, they're all interrelated. There's all these connections. We had done a lot of blood. I looked at all his blood tests and they had never tested for thyroid either. He was hypothyroid also, and we needed to fix that. So this was a huge concern. He lived in an agricultural area. I was like, do they ever, the planes come down and crop dust the plants and yep. Okay, great. We have a big toxic issue. His body is not eliminating toxins. You can see here, this is a common pattern right here, this calcium, magnesium, sodium, and potassium. When I start seeing this, a lot of pets are deficient in calcium and magnesium. They have elevated sodium, and potassium is usually low. Sometimes it can be elevated. This right here is a sign that we have stress. We have inflammation. This is a very common pattern. And when I see sodium this high, we should be less than 100, 369. That's because we have heavy metals and a problem there. Iron will also rise along with chromium when we have heavy metals. So all of these are kind of connecting the dots, like his body's struggling at a cell health level. And also to his phosphorus, he's on a high protein diet, but he is breaking down those proteins and he's not absorbing them, and he needs more digestive support. And then when I come down here, I'm looking at ratios. Ratios are going to give us kind of like, how is the body working? The calcium magnesium ratio is going to show us, are they processing carbs? So if you're feeding like a higher carb diet, like a kibble diet, and this ratio is really high, our pets are not doing well. They can have insulin resistance, especially if the heavy metals are relatively normal. We will always have heavy metals because we live in a toxic world. My goal is to see how well is your pet processing those heavy metals, and Roper is not processing them well. The calcium to potassium ratio is what we call a thyroid ratio. So this is telling us how fast or slow is that. A lower number tells me the thyroid is working overtime. So he's hypothyroid, right, on blood work. So this is the difference between blood work and hair tissue test results. So you would think it would be sluggish, but his body's working so hard that thyroid hormone, the active T3, is actually not able to get into the cells because calcium and magnesium are deficient. And that is required to allow the thyroid to enter the cells, the thyroid hormone. So I'm like, okay, he's burning, and he's also burning through calcium, which is creating more of an issue here. And then the calcium phosphorus ratio, this third one down, is low. This is really common. This is where we look at, are they stuck in a fight or flight response? Or are we more balanced in that parasympathetic healing? This is a sympathetic overdrive. He is in fight or flight. He's anxious. Of course he's anxious. He has too much aluminum. That crosses the blood-brain barrier too. That increases inflammation in his body. So, yep, he's ticking all the boxes. We need to fix this. Sodium magnesium ratio is elevated. This is adrenal stress. His adrenals are struggling. They are trying to keep up, and they're having a hard time. And then our sodium potassium ratio is looking at kidney stress. It's elevated. So that makes sense. We're trying to detox, and those detox organs are having a really hard time. And then zinc copper ratio is we have a zinc dominance. I don't always say we may need a bit more zinc, even though it looks like zinc's a little bit high. And we can use whole food forms for zinc too. We don't necessarily need, this is not the time and place to necessarily reach for synthetic vitamins and minerals. Using whole foods and glandulars are where I typically reach for. So seeing those results, I was like, okay, we got to fix. Detox is key for him. It is really, really important, supporting digestion, and also to making sure his hormones are getting better balanced. So he was put on a the thyroxine, to help bring that thyroid hormone up. We did a full thyroid panel. He didn't have antibodies to his thyroid, which was good. But this is him. So you can see I put the dates there too. His aluminum dropped by half. So you can see it's dropping. And the other factors, I actually didn't put the other report up here, or the other part of the report, but I wanted to show you that those levels, they can also go up. So if we're seeing improvement in your pet's symptoms and you retest a hair sample and the heavy metals increase, that's where I go, that's good. That means we're getting out those hidden heavy metals. The body's tolerating it better. We need to make sure we're supporting those kidneys, the liver, the mitochondria, getting the toxins out of the cell through the liver process, out into the gut. The gut needs to be working. We need to bind to it, bind to those toxins so they don't get recirculated. So if you're seeing higher levels, it's not necessarily a bad thing. It can be a really good sign. And I wanted to share too some sources of aluminum, because people always freak out about this, which makes sense. But we are surrounded by these. I always always see some level of heavy metals. Mercury and aluminum are always higher in every single pet. But there's levels that I look at to see, are we at a toxic level or are we coping? Do we have those pathways open? I feel personally and have seen in my personal experience that if we support detox pathways, our body is incredibly resilient and can handle what we throw at them. Toxins scare people, and it puts another layer of emotional health stress on everything, which can create more imbalances. But there's a lot of different things we can do with food and certain types of supplements to open those pathways up and to use binders in a specific way. And this is where understanding where do these toxins come from and being aware of your internal environment and your external environment outside your home will help you feel more confident and empowered. You're like, I got this. Really, really important. So the other thing I wanted to point out here too is that I want you to look at what are the symptoms of aluminum toxicity. So Roper had chronic pain. Pain meds weren't working. Well, why was that? Interesting. It wasn't working because he was toxic. It was creating another layer of resistance for his body to heal. But also you can see allergies. How many pets have allergies? You might be experiencing this. It may not actually be allergies. It may be the level of inflammation in your pet's body from something like a heavy metal. So this is why this is really, really helpful to identify where to go and uncover those layers that may be impairing the healing of your pet if you're dealing with a chronic health problem. And then I had to throw in my kitties. I love my kitties. I'm actually surrounded by cats right now. You probably can't see them. There's one actually behind my chair that just sat next to me, and one that's in the bed on the desk. I love black cats. I have 3 black cats, and Boris is an awesome 13-year-old neutered male cat, but he had chronic GI issues, IBD, triaditis. He had his gallbladder removed, pancreatitis, constipation. This poor kitty was throwing up hairballs twice a week. Chronic kidney disease, just to complicate things even more, right? So he was on a gently cooked balanced diet. So we did a hair tissue test because I wanted to know, is this, what other things can we uncover to help this kitty feel better? Because he's just the coolest cat. And I love cats. Cats are awesome. Do we have any pet parents here? Cat parents? Comment in the chat box. We got to give cats some love because they don't get enough love from us vets. Perfect. I love it. Awesome. All right. So these are the hair tissue tests for Boris. So when I'm looking at this, as you can see, so we have mercury, we have aluminum, we have a little bit of lead, cadmium, arsenic. Arsenic, if you're feeding rice or a processed diet that has a lot of rice in it, arsenic and rice go together. And I tend to see that rise if we're seeing that. So it's something to be aware of. The aluminum looks like it's at the highest level. It is not, as you saw from Roper's. I've had pets at 70, which was crazy, and the dog was experiencing allergy symptoms. Obviously, it was an aluminum toxicity, but 1.7, we should be under 3.2. Mercury looks like it's kind of elevated. We need to be under 0.04. So there's levels that we have where we start going, there's a lot of issues here. Now, keep in mind, this is the first hair tissue test. So there can be other heavy metals that are buried or hidden that haven't come out as we start opening up these pathways and start bringing down inflammation. So inflammation and detoxification have inverse relationships. Inflammation needs to come down for detoxification to actually work, and vice versa. We have lots of inflammation, detoxification will not work. So very important principle, seems very simple, but it's commonly missed. Now with Boris, big concern I have, like, it's not too bad. Magnesium's a bit low. You got to be careful with kitties and magnesium and causing like crystals or stones. And with kidney disease, we don't want to be supplementing magnesium. It's contraindicated. So there's other ways to do this, right? We know that look at the sodium level. We are definitely over 200. We're at 334. There's a lot of inflammation in this cat. Well, of course, he has about 5 different itises. Those are inflammation of different organ systems. And then also too, when I go down to the ratios, I'm looking at, once again, we have a lot of adrenal stress. This cat has a lot of stress. We're producing a lot of cortisol from those adrenal glands. At some point, that cortisol just stops getting pumped out of those glands, and things don't work. So we need to support his adrenal glands. So this is something where, there's certain supplements, there's certain herbal remedies that we can use. I use a lot of Chinese herbal medicine and Chinese food therapy. So we had used a lot of these for him to help him balance. Manganese is a common one also I wanted to point out. This was low also in Roper. Manganese also will sometimes stay a bit lower with heavy metals. It is really closely connected to other areas, but a lot of diets are deficient in manganese, whether it's a raw food diet. This is something to be aware of. If you're feeding a processed food diet that has synthetic vitamins and minerals, we know those aren't as well absorbed. So keep that in mind when you see this. The practitioner should be looking at the other factors and what's happening. But he's doing okay with his protein levels. His phosphorus looks really good, but he's got a lot of inflammation we need to resolve. The heavy metals are not a huge issue, but he does have issues. He's missing a gallbladder. He's not digesting his food well. So that's a key area, is healing leaky gut, supporting the microbiome, and naturally reducing inflammation. One of the ways that I love doing this is with herb gardens and using self-selection. So this is my little cerebellar hypoplasia kitty right here. This is Moki. He's actually sitting behind me on my chair right now. That's why he's a bit wonky, but he loves his herb gardens. And I'll put down, he's self-selecting there's ginger in front of him. He loves rose. I always use valerian, especially with multi-cat households, for stressors. This is another kitty that's sitting by and self-selecting different herbs. So using different herbs and just putting them down dry, an organic herb. You can open a tea bag if that's all you have, your organic tea. I love tea and using those for my patients. But with cats, we have to get creative. And these herb gardens are really easy to use and really, really helpful for allowing your cat to self-select what's going to help them heal from an emotional, spiritual, and physical perspective. So I wanted to share that because my cats love their herb gardens. One of them destroys it, but that's okay. Then we have Leo. So Leo came to me. He was a 2-year-old neutered male Labradoodle. He was having trouble gaining weight, and he was experiencing repeat rounds of bloody diarrhea, vomiting. He was having ear issues, allergies, not wanting to eat. He was very reactive, also just super hyper reactive, barking all the time, super sensitive. And unfortunately, which is a very common thing that happens, the veterinarians that they were working with, they put him on a hypoallergenic diet. And they also put him on omeprazole, which is an antacid, and Tylenol powder. Well, they came to me because it didn't work. And they just kept using multiple rounds. I believe he was also on metronidazole a few times. That's usually the same story that I hear. Multiple rounds of these things, trying the same thing over and over again, trying the same tests, and they're not finding out why. And so we ran a hair tissue mineral analysis test, and they're in Canada. So we can do these hair tissue tests from anywhere in the world. That's why, another reason why I love them, but also too, they can show us what's happening. Okay, so what's happening with Leo? Here, aluminum, we're at 11. We should be less than 3.2. This is a problem. That's going to be contributing to his gut not healing, so increasing inflammation in that gut lining. It's going to be crossing the blood-brain barrier and contributing to his anxiety. This example we see, he's also very deficient in calcium and magnesium. This is bad. This is very, very low. His sodium levels aren't as elevated as I was expect, but I see this a lot, especially with a hypoallergenic diet, because they don't have a lot of nutrients in it. And we're relying on all synthetic vitamins and minerals, which aren't well absorbed, especially for a pet who's experiencing gut health issues. So copper dominant, probably because we have synthetic vitamin like copper also, which is not going to be helpful in the situation. And then we're also seeing chromium. He was on a dry food diet. Chromium is related to insulin. So if we're seeing this elevation, especially with a pet who's on a kibble or a dry food or high carb diet, so even if you're making your food a homemade diet, or feeding some of these like pre-made, lightly cooked ones, they can be really high in carbs. And when I see chromium, we're having an issue most likely with insulin resistance. So this is probably a factor also of the aluminum because his calcium magnesium ratio is relatively normal. So he's probably not experiencing insulin resistance because I would expect this to be higher. So this is probably the copper elevation, chromium elevation are probably related to heavy metals. And I suspect this aluminum is probably higher than what it's showing. It's just we haven't seen it yet because we haven't started pushing detoxification. Now, phosphorus is also pretty low. That's because we're on a low protein diet. He has a gut health issue. He's not absorbing those. So whenever I see this, I'm thinking we need digestive enzymes to break that down. We need to look at, I'd love to do an animal biome test. They weren't able to do that due to financial reasons. So once again, like all these tests that we have, if you can't do all of them, that's okay. That's why I really like the hair tissue test because it gives us so much information on all these different areas. We can also see his calcium potassium ratio is really low. His thyroid is working really, really fast. Now they did test thyroid with their veterinarian and his thyroid came up normal, which is good, but it's still working hard because of the heavy metals, because those metals concentrate in a lot of these glands. The calcium phosphorus ratio is low. So that's that sympathetic dominant nervous system state. That's the fight or flight. When we're stuck in that state, we do not digest. It is not the time for rest and digest. There's no blood flow going to the gut. So we need to shift that. There's a lot of different ways you can do that with CBD, ashwagandha, a lot of techniques, energetic techniques, Reiki. I use a lot of essential oil. There's a lot of different ways to help shift pets into a healing frame. But that gives you an idea like, oh, wow, they're kind of struggling. Let me incorporate some of these into my daily routine. And then, of course, sodium, magnesium. We have a lot of adrenal stress going on here. He's just acting crazy. His aluminum is accumulating in those adrenal glands. So I look at this also too, a zinc copper ratio is a little bit low. We are copper dominant. This is a situation where I would want to increase the zinc to help with that. That will also help with the allergies. Remember, he's experiencing skin allergies too. So if we were to just put him on, I can't remember if he was put on Apoquel or Cytopoint. I don't think he was, but that would be the next step from a conventional, traditional way. What would that do to a system? We're treating the wrong thing. We're suppressing an overworking immune system, but we're treating the wrong thing. So that's why these tests are really, really helpful. So once again, we use these tests to really improve pet health, find the imbalances. So we're going to use them to identify diets, choosing what supplements are going to help repair those imbalances. Toxin and detox support is a huge area of interest of mine that's so helpful, and it's commonly misused, done inappropriately, or not even done in the first place. Supporting gut health, supporting emotional health, supporting physical health, supporting hormonal health. And I wanted to remind us again of this scale. We have health on one side, we have disease on the other, and we are constantly moving along this scale with the choices we make. So just because we don't see a symptom does not mean that we might be moving closer to disease and a diagnosis. So keep that in mind. And I also wanted to share this because, yes, it looks quite complicated. This chart is really important, and it's the detoxification. I'm one where I actually feel like every day there needs to be an awareness around detoxification. Because of the toxic world we live in, the emotional side, the cellular health side of detoxification, our cells naturally producing ATP or energy in the mitochondria, they're actually producing toxic byproducts at this very moment. And if we're not supporting detox, they get clogged up. Or if you have a pet that may be struggling in that area anyways because of genetics, for one, it doesn't mean you're doomed because we can use food and supplements to change the way those genes are expressed to help them. But we don't want these to get clogged up because then it leads to that increased inflammation. Detox works less. But I want you to look at this. There's different parts of detoxification. This is just the liver. This doesn't include the kidneys, the lungs, the skin, or the gut that are also huge parts of detoxification. There are different phases. Now, in the liver alone, what happens when toxins come in, we have different steps. You'll hear phase 1, phase 2. So what happens, we have fat-soluble toxins coming in. They have to be converted to even be turned into a waste-soluble product after step 2 to then be removed out of the body. The first step makes toxins more toxic. And I want you to see there's required nutrients here. So if you think about, my pet may not be absorbing or digesting their food or getting all of those nutrients. If we're lacking B vitamins, if we're lacking glutathione, if we're lacking certain antioxidants, vitamin E, vitamin C, what's going to happen is those toxins aren't going to be processed. So what's going to happen is they're going to get kicked back out into the bloodstream, and we may see a flare up of allergies, ear infections, hot spots, because those toxins didn't get processed. They have to go somewhere. They go back into the blood, and then they can get stored in the fat. Hello, lipomas, right? But then, okay, let's say we process it. Now we have a more toxic substance that has to go through step 2. Step 2 is what takes that really toxic substance and turns it into a water-soluble product that then can be removed from the body through those pathways listed there. I want you to see, so these required nutrients, glutamine, glycine, taurine, the sulforaphane phytochemicals, so things in like broccoli, Brussels sprouts, your cruciferous vegetables, garlic, which is not toxic to pets, by the way, in the right dosages. But think about if we are deficient in any of these amino acids or nutrients, the more toxic substance can't be processed and gets stored or creates more inflammation in the liver or gallbladder. If you think about the toxins too that we see here, just there's a list there. Obviously, alcohol is, this is a human chart, but pesticides, herbicides, cleaning products, chemicals in the water. And this is not meant to scare, it's to show why we need to support detoxification every single day. Because if things get stuck, inflammation increases. And then we stay on that path. Remember, we're constantly moving along, from health to disease. We get closer to disease, and it complicates and it makes things harder. So those hair tissue tests are really helpful. So you know where to treat, where things might be a bit deficient or in excess, so you can support your pets. And I talk about 5 pillars a lot because it makes it easy, because everything is interconnected, from gut health, nutrition, immune health, environmental health, emotional health, physical health. And when we think about those pillars, we can check off if we're solidifying that foundation through nutrition and gut health. I'm a big fan of testing to figure out where gaps are. But if you can't, you can still follow these frameworks and these foundations to get the results you're looking for, or be proactive and prevent disease in the first place. We want to assess our environment, our emotional health, our immune health, and make sure our physical health needs are being met. And remember, it's so easy to miss the forest for the trees. When we look at allergies, for example, when we look at how do I treat the itchiness, I want you to start asking, if you're not already doing, ask the question, why? Why is the itchiness there? What is off in the body? Let me go back to the foundations. This is exactly how I work through my own health, my husband's health, my own pet's health, my clients and their pets' health, because that's where we find the missing pieces to the puzzle. So make sure you don't miss the forest for the trees. And as I always say, your pet's health is an investment. I can already tell you guys are awesome, amazing pet parents. You're invested in learning more to make sure that we can show up as best as possible, and we can do as much as possible and be as proactive as possible for our pets, keeping in mind you will always continue to learn. And I want you to question the things that you're learning, because there's things that I question now that I learned years ago when I first started as a veterinarian, and things change. We have so much research coming out that I'm so excited for the next 5 years and what's going to change with the protocols I use, the way we approach health and support ourselves. So always keep an open mind. It is really, really important as you are on this learning journey. And if you do need help or guidance with hair tissue tests, we do run them at thenaturalpetdoctor.com for pet parents across the world. So you can always reach out to us. We are one of a couple companies, but I'm super happy to answer any questions. I know that was like a higher level overview, but I wanted to give you some practical ways to look at how do we use hair tissue tests? Why would I use it? And give you some applicable things that you can use for your pets to get started in the way I approach health with my patients and for my own self. So on that note, Poppy, I will end this and stop my share.
Yeah, and let me
see
bring
you.
up my screen too. You guys, that was amazing. Wasn't that good?
That was awesome. I cannot tell you, as a nurse, when I try to explain to people, I don't care what the blood work says. That doesn't mean, their sodium and their potassium and their chloride might be normal in the blood. That doesn't mean they have good reserves in the body.
Yes.
And I can't, it's so hard to get that across.
Yep. It is.
My
Dr.
blood work,
Katie, go ahead,
I
Jen.
was going to say my blood work was perfect for 40 years, even though I was dying of 14 diseases.
Yep. It's blood work. I always say there's different tools that we have. This is a tool in the toolbox. And blood work's important because we can track trends, especially with cats and like kidney disease. I always say like looking at that, creatinine, SDMAs, there's things that we want to look at and track that are going to help identify if there's something going on to pick up on it sooner than it becoming full-blown disease, which is, we can still treat a lot of things, but it becomes harder to treat. So blood work is important, but there's so many functional medicine tests coming out now that are so exciting that all complement one another. But like, I love that Poppy you asked me to talk about this because it's one of the newer tests in the last couple of years that I've started doing. And you can see why it uncovers a lot of different like things that I would have missed. I would have had like Roper. I would have had no idea that aluminum was the reason why his back pain, he wasn't responding.
So his back pain went away after
Yeah.
you.
Yeah. I mean, we
That
did
makes sense.
acupuncture and other things, but
So
but yeah, that's exactly right. Like once we started treating the underlying thing and allowed his body to actually start healing, we're removing the resistance to healing is how I look at it.
I love that. That is so cool. So I used to do a lot of equine body work. I still do it, but I don't do it as much as I used to. And I would get calls out for chronic back pain too. And I'd do a kidney cleanse and the back pain would go away after like 5 chiropractors had worked on these horses. And I'm like, let's just cleanse the kidneys. So I
Yeah.
was wondering if Roper's kidneys were inflamed, his adrenals were swollen, right?
Yeah, his adrenals. So looking at, I'm just going to bring up that. So his kidneys were also like he was at 10, he should be at like 0.5 with his ratios. So of course, when we think about, that chart too with the detox pathways, I'm a big fan of using binders because that's the third phase of detoxification out through the gut. Because if we're not binding to things, they're going to get recirculated back into the liver through that portal vein. And a lot of people don't realize that. We're using like, milk thistle. So milk thistle phase 1. Okay, we need phase 2 also, and we need phase 3 in the gut. Phase 3 also, like kidneys are a big part of excreting a lot of toxins and they never get talked about. They have the same phase 1, like phase 2 kind of detoxification as the liver does also. So kidneys are really important. And if you have a cat or a dog with kidney disease, and that, we know we need to really support detoxification because they're going to be struggling in that area.
Dr. Katie, are all these cats with kidney disease high in aluminum? Is there-
I mean,
is
here's
there-
where like Boris wasn't, but here's the other piece too. Sometimes people will test once and they don't retest. So I find we see a lot of heavy metals go up the second time, or if the first time you have none and you retest, that's where you'll see a lot of heavy metals appear, because now you're pushing things out and you're opening up those pathways. So with with your hair tissue tests, you never test sooner than 3 months, because that's your hair follicle cycle.
Yeah.
So we never test sooner than that. But for like Roper, I would have loved to retest at 3 months. We couldn't like there was a financial like inhibition, which is okay. Like, and so we were able to retest again to make sure it was working. But it was, I think it was 9 months later, we were able to do it. So for those pets where I'm like, we have a higher heavy metal, or there's a lot of like inflammation or changes, I always say, 3 months or 6 months. And then for pets that are pretty good, or you're doing a proactive approach and there's not really any health concerns and they're doing like fairly well on that test, like every year is the proactive approach, like testing wise.
That is so good to know. And thank you for that 3-month window, because I was detoxing some of these horses. Does this, and by the way, does this kit do horses also? Or is this just?
I don't do horses specifically. So you don't want me telling you about
Not,
horse
Dr.
stuff.
Katie.
You don't want me
But
doing horses.
every
I'm not going to be helpful for you. The horse stuff is like gone. I passed my licensing exam and it's gone.
So all the horse hair mineral testing I've ever seen has been through the roof on aluminum. And I always thought it was like the barn and the fencing and,
You can have, I mean, the dirt. So like, here's what, and if they're not, like, have them rub down like where they're collecting the first, like the hair sample, if they're not. So that's where, like, if you have a dog that's an outdoor animal, like bathe them and then wait until they're dry and then collect the first sample. You can also use alcohol on that area and just let it dry and then collect it. That's okay to do too. But
for
you
the
can't
first sample.
for the first sample. So if
Okay.
you're like, especially for horses, you're 100% right. You're going to have heavy metals in the soil, the dirt. If they're rolling, they're outside. So that is a thing you have to take into consideration. But also too, what foods are we feeding? Are they high in glyphosate? Those are heavy metal binders, and that's going to bring heavy metals into the body too. So horses.
Dr. Katie, they get shod sometimes with aluminum shoes, but more
Yeah.
often steel. So I wondered if there was some weird absorption. Why wouldn't there be?
Yeah,
There
that
does.
makes sense. I mean, that makes sense.
Yeah.
So, I mean, you look at the sources of aluminum for us and for our pets. I mean, the baking materials that we use, like, or, the cooking materials,
Teflon
like,
or
yeah,
whatever.
just in
Yes.
cans, like canned cat food. That's going to be a source of aluminum also. So if you're finding we have really high aluminum and you're feeding predominantly like a canned cat food, that would be a warning sign to me of like, okay, can we transition this cat to a different food? Which I'd want to do anyways if we could. So, but it just gives you an idea. I think too, these tests, it gives you more impetus to make those changes, because sometimes we get settled, right? You don't see symptoms and you're like, things are fine. They're fine. Everything's fine. I'm fine. My cat's fine. And then all of a sudden you're not fine. And that's been my journey, and it can change everything. And so if we can be proactive and do the test and see, that it can be really helpful.
Okay, so we have a vet, Gabby from Mexico, and she wants to know how she can learn how to do this.
So Dr. Ava Frick has a lot of like books and resources that you can use. So she's really, really helpful, and she'll also do calls with you. Um, you have to pay her, but she'll answer questions and give you feedback and guidance. So it's a matter of like, there's, I'm like, I think 3 or 4 books that are like textbooks on teaching you how to do it, and then doing them is really, really important. And also looking at the bigger picture for your pets too, and putting everything, how is everything interconnected, is really key. Because if you don't understand like the nutrition side too, like it is really hard to put everything together if you don't have that foundation also. So like taking extra nutrition courses, the CIVT one is one that she could always take too, College of Integrative Veterinary Therapies or Therapeutics. They have a natural nutrition course that would be helpful also for understanding the vitamins, minerals, and then also to like foods that you can feed or to help transition your patients onto fresh food diets or minimally processed foods also.
We almost saw a dog take the groceries off the shelf, it looks like. Julie wants to know, how do we get a consultation with you? How do we do this?
So the hair tissue test. So the big thing, so I do things differently with my practice. So I actually have like a blueprint program that's a lifetime program where I work like with pet parents in a group setting, but provide individual feedback for them. And the initial, like coming into that program, I actually do a hair tissue test. So I work with like gut health and skin issues. So chronic issues there is like the focus of that program. So if that's something that a pet parent's dealing with and they want more guidance and help and they want to remove like the time frame of healing and have constant support and guidance from myself, that group is something. I do calls with people. It's an application program. So they can go to the website and go to our services and schedule a call with me to see if it's a fit for what they're looking for. So that's one way that I work with pet parents specifically and individually. The hair tissue tests, though, it is a separate service. So you can do that as a one-off. That is on my website at thenaturalpetdoctor.com under our storefront. If you go to the storefront, you'll see that there. And I create the report. So everything I talked about, I go through, you fill out questionnaires, a couple surveys, provide information that's going to help give me feedback on what's going on. Some people just do it as the proactive test. And then I provide information on nutrition from a food therapy perspective, and then also supplements or other ways to help support all those things that we just talked about. So that is an option for anyone to do at any time outside of the program.
That is awesome. I love that you're rethinking veterinarian medicine.
I had to. I mean, here's the thing, when you go through a health crisis, I don't know if anyone else here has been through something that completely changed your life, right? And you're like, huh, that way does not work. Or like what they're saying makes zero sense. Like being told there's nothing you can do. Like for my husband, strong immunosuppressives, they don't really work. Some of them can literally kill you. And it's, hearing food doesn't matter with like a gut health issue, and then going into the rabbit hole and finding this whole world of medicine. This is where, like, whenever I hear people being told there's nothing else you can do, I've been there and it's something that sticks with me. It's like, I never want to be that person ever again telling people there's nothing else you can do. I may not have all the answers. I may not have all the tools to be able to help you, but like, let's find someone that can like complement that or can find what you're needing, because the body's amazing when we give it the resources it needs to help heal. And that's where, removing the resistance. The body's resilient. We have to remove the resistance and keep in mind it's not always a physical thing that we can do. Sometimes it's an emotional or spiritual thing. I find that's
Oh my God, we need you cloned, and we need to start opening medical schools to actually teach this, because this is actually healthcare and medicine. That's not what they're doing now. It's so frustrating.
Oh, I
So
know.
frustrating.
I have my brother's a radiation oncologist and his wife is a neurosurgeon.
Oh God.
That's awkward at family functions.
It's okay. Like it's fine, but we don't
I'm a
talk about nutrition.
So
I'm a
Katie,
homeopath, and my brother works for a pharmaceutical industry. Yeah,
Yeah.
similar.
and Dr. Katie, I'm sure you look a lot healthier than they do.
I mean, I don't know, sometimes, maybe some days I don't. So, but I mean, here's the thing. What I know to be true is that my toolbox is a lot bigger, and it's one of those things where like it's it doesn't rely on a medication or a drug. I'm not against drugs. Like I'm not against, there's a time and a place for medications. That is something that I'm super transparent about. Quality of life is always number one for me. If something severe is happening and we need to like bring things down quickly for the quality of life while we're healing the body, sometimes that's what's needed to take that pressure off so that other things can then start working. But there are so many tools like, like all the stuff you do, Poppy, also, like, it's amazing. And just, I'm sure other pet parents and other people who are here, there's so many tools. And it's just, it's an incredibly empowering world that we are in on this side that we can integrate into conventional to get even better results for ourselves and our pets. So, yeah.
I love that you do amino acid therapy. I am such a fan of amino acid therapy and nobody talks about it.
Well, I mean, it's a detox. I mean, you need it for
It is. It's
detoxification.
totally a
Well,
detox,
like
but
everything. I mean, you
nobody
need it
talks.
for everything. I mean, I'm super in like a rabbit hole right now, taking a course on immunology, and oh my
Oh,
goodness.
God.
Yeah. It's pretty intense, but it's important because especially with chronic health issues, what happens, we get this level of inflammation and the body shifts. So this is where a lot of people are doing like the fecal gut transplants, and you're not getting results, and you're like, why is this not working? And we're healing leaky gut and we're feeding the right foods, and you're like, why isn't things working? And it's because the body is like imprinted into this like inflammatory state, and we need to shift it. And there's ways to do that with herbs and other tools. And and like I said, it's not, there is a huge emotional spiritual piece to this too that a lot of us don't want to touch because it's uncomfortable, but it's creating another layer of resistance for us and for our pets to heal. So that work also is really, really important too for getting to like letting go of a lot of stuff is a key thing too. Really
Yeah,
love that.
I'm a big believer of suppression being
Hmm.
immune issue, like
Yep.
physical, emotional, spiritual suppression. So I definitely think that's a huge topic that people leave out. We do pet prayers here in this group.
Oh, awesome.
So, yeah, so I believe that mind, body, soul, spirit, lifestyle is all important. Um, you know what? You're just awesome.
Aw.
I love you more now than ever.
Well, thank you. I'm
I'm
so
s-
grateful for coming to this awesome group and just sharing a little bit of, what's helped me along this journey. And, if
uh,
anyone has any questions, or if you have, you want us to do a hair tissue test, definitely reach out to us too. Awesome, Debbie. Love that.
Well, and Debbie, you're the one when I heard Dr. Katie at Thriving, I was like, oh my gosh, Debbie needs to hear this. You were the inspiration for me reaching out to Dr. Katie because
Aw.
she has a dog that is in a chronic spot and everybody's calling it allergies. And I'm like,
Hmm.
it's not.
Hmm.
I'm surprised how much high sodium on raw diets these animals are on. How come?
So it's not salt. So
Oh,
sodium's going to be a reflection of aldosterone hormone, which is connected to your adrenals and your like HPA access. So this is something definitely where like I write that in my reports too, but like salts, it's not salt.
okay.
So yeah, so it's not connected to salt. It's more of like level of inflammation and stress levels. And keep in mind too, when I say stress, because this is a common thing that I hear, is like my pet's not stressed. So they may not be outwardly stressed, but internally that body's working harder. And it's okay because it's like, oh my God, am I stressed? Like I'm creating this and all the things. And then we go down that really bad rabbit hole. So keep that in mind. When you hear like something is stressed or something's working harder, it doesn't mean you are creating that. Like I showed, it could potentially be like we just have blocked detox pathways and we need to do something to help open those up because a lot of times we aren't covering those areas. So, detox is I love learning about detox. Like I love detox. I hear and I used to be this way also too, and I changed the way that I approach it with my patients is, we should do a quarterly detox. Has anyone else heard that? Like, right? We should do a quarter, but I'm like,
I
what about
hear
the
you.
time in between?
Yeah.
Yeah.
I'm like, this doesn't make any sense to me. And I get like big detoxes they can be hard on the body. We don't want to be doing a big detox every single day, but there's little things that we can do. This is where like sprouts are super easy to add to the diet. Or if you're doing like for for me personally, going back to my Finn, my shepherd that had a brain tumor, we live in Fort Collins. And this area, I have never seen so much spraying. They spray for like mosquitoes, and I didn't take it as seriously as I should have. And after moving here is when we lost our 3 pets to cancer. Brain tumor, glyphosate, my neighbor's spray, all those yellow flags, and then finding out that the city sprays for mosquitoes. Like now I'm like, holy smokes, like talk about a canary in the mine. I need to support my pathways more because I'm at a huge risk. And then supporting my 3 cats. They're indoor mainly, but they can still be exposed to that. We can bring things in. So I incorporate detoxification into their diets and their protocols every single week. So keep that in mind. Like this is where my situation will be different from every single person's situation here. But when we know, we can do better. And I just didn't know. I didn't like it, but I didn't realize like this toxin that I couldn't see the impact that it could potentially have on my pets. So I can't say it caused it, but it didn't help.
Do you see patterns related to glyphosate? Do you think?
I see, I've dealt with a lot of bladder cancers, especially when I was working in like conventional practice as like the integrative vet. And one of the questions I would always ask is, do you live near a golf course? And it was really common. So, unfortunately, if you ever decide to post about glyphosate on social media, just get ready for some excitement around that. But because I post a lot about it, I get some really fun comments. It's one of those things where it's everywhere. It's in 90% of the rainwater. Like we're being rained on, we're drinking it. I use a Berkey water filter we have for years. Filter your water. Water is like the biggest source of like toxins, fluoride, all the things that are in there, heavy metals also, and then all the carcinogenic things. It's a huge area that's missed. So if you can filter your water and then support your pathways, that's the thing. Like, if you're strong and resilient, you can handle it. That's the key. Like, I think a lot of people, there's a lot of fear that's created, and I don't think we need to create the fear. I think we just need to create knowledge and acknowledge that we live in a toxic world versus creating fear. And then you're like, I have to, yes, remove the things that you can, avoid the things that you can, but you don't need to sterilize your environment. And we can never get rid of all the things. But if we know and we give grace and say thank you to our bodies for the ability to like support us, that's really powerful also. So keep that in mind too, because it can be really scary when you get into this world, like, and then it ends up creating a lot of fear, which then impacts your ability to heal. So keep that in mind. I find that's just a big area that
It's great.
we end up creating a lot of fear and we don't need to.
Yeah, I love that because it can be disappointing when you get a lot of run around and you lose hope.
Yeah.
And so that's when it starts to circle the drain at that point.
Yes.
I
It does.
And when you think that you're doing really well, like I thought I was doing really well by getting organic vegetables from other countries. So it wasn't going to be, it wasn't going to be GMO. And then I found out that at the border, if the
all
vegetables
sprayed.
aren't packaged, it gets sprayed with GMOs.
I mean,
It's-
that's a thing, like,
Or irradiated.
yeah,
Yeah.
irradiated. I mean, here's where I look at, you're doing the best that you can with what we're able to do and the knowledge that we have too. It's
Yeah.
at the end of the day, I look at the people here and the people that are in like the more integrative, holistic community, like worldwide, like the things that we're doing. Imagine if you weren't doing them. That's why I look at Finn also. Oh my gosh, if I hadn't changed his food, if I hadn't put him like he had 2 torn cruciate ligaments before any of the cancer stuff. And we didn't do surgery because of all the things that I was able to do with him. So I'm
Mhm.
like, God, imagine if I hadn't even started all these things. He would have probably gotten sicker sooner. I don't know, but like, thank goodness I at least knew something and I had done some of those things. And it made a difference. You know, things at some point none of us are going to win the race, right? We're all going to, I mean, I guess we do win the race, but we're not going to be here forever. We're all going to pass at some point from this physical realm, whatever you believe in. And we're all doing the best that we can. And I think it's just important to be kind, come together, share the knowledge, help one another out, and just like love our pets because they don't have long enough lives physically with us.
Allison, do you have a question?
No, I don't. I was just turning my video on. This has been great. This has been wonderful.
Awesome.
Awesome.
Thank you, Allison.
So encouraging.
Yeah.
It's just fun when like-minded people get together. You guys
Yeah.
I just find it so exciting.
Yeah.
It gives you hope.
Yeah,
gives you-
and it just kind of like kickstarts you a little bit more going, yeah, you're in the right direction. I've really been, because of all this Purina issue, I've been thinking about, okay, the detox aspect of it, and, could be mold, it could be biological, like a pathogen, it could be a regular toxin.
Be heavy
And
metals.
So you would approach these things differently.
Mm. You do. I mean, they're all detox different. I mean, you have forever chemicals, right? But from what I've seen, especially because we don't have a lot of research on the dog and cat side, right? A lot of the studies that you take are going to be on the human side. They're working on lab animals. So we're extrapolating a lot of that over to our pets. But I can tell you with a lot of the research on the human side, you can get these things out. You just have to follow a certain path. Like with detox, what happens is we work at like the macro level versus the cells, and then we don't bind things. So we don't do it the right way, and we end up with Herxheimer reactions. And that's a sign that we didn't detox properly when that happens. Like if you give something and something flares up, that's a sign that some pathway is not open. And we need to go back to, okay, well, why is that? And it's not always easy. Like it's not easy for me sometimes, where you've just got to really think about, okay, well, what does that supplement do? What does that herb do? What pathways is it working on? That's why it's really important to, not just try things because Susie said it worked really well. Like that's really important. Case study of one, we don't know why it worked. Her pet's different. So it's important to like learn more about like, okay, I'm going to use quercetin. What does it do in the body? It's pretty amazing. It works on the gut. It works on reducing histamine naturally. It works on mitochondrial health. It works on NRF2. Like it does so many amazing things in the body. So if you better understand that, and that's information you can get online or, continuing to learn, then you can start piecing it together and be like, okay, my pet probably has leaky gut. This may work. Let's give it a try. If it doesn't work, okay, keep track of it, journal it. You become the scientist to better understand what you're using and what's helping your pet, keeping in mind that if something doesn't work right away does not mean it's not working. That's really important. So there's a lot of jumping around that happens, and it keeps people really stuck and frustrated. And sometimes we have to have the patience of the journey, because your pet didn't get to where they are. Usually, like they didn't get there overnight unless like it's an acute toxicity, right? But it took time for them to get there. So it also takes time to heal them too.
All right, you guys. Gina says this is exactly what I needed to hear. Thank you. And Christy Green wanted to know, milk thistle is level 1. What were the other 2? Do you want to repeat that? Or I can also drop the graphic in the because I've seen that graphic before.
Yes, I've used it. I've used it before. Yes, it's in some of my other like free presentations that are on YouTube also, for like finding the root cause and things like that. So Dr. Katie Woodley, the natural pet doctor, I talk more about detox. So this is where like glutamine is a big one. Your glycine, taurine. Now keep in mind, I'm not saying to add these individually. but we want to make sure the diet encompasses them. That comes from like a well-balanced diet full of variety. So just keep that in mind. This is also too where your cruciferous vegetables are really, really helpful. So sometimes what I'll see is detox reactions if we add in like sprouts, a lot of broccoli, your Brussels sprouts, and that was the only thing we changed or added in. And so why is that? Because we weren't supporting phase 1. So we've got like a block, or we weren't supporting the phase 3, which is the binders. Because if you are pushing toxins out, we still need to capture them and remove that. So that's like the big thing with like zeolites, your humic fulvic acids. Keep in mind, they all have different binding affinities. They bind to different particles, like activated charcoal grabs everything. That's why we don't want to use it with like meals, because it will bind to your vitamins, minerals. And if you're using that like every day, it can create vitamin mineral deficiencies. Your humic and fulvic acids, your zeolites, they tend to be low binding affinity. They don't bind to things as well. So for like Roper, who's at a 44 aluminum, I use stronger things. I use multiple things, like bentonite clay is going to be your acacia fiber. I use some Quicksilver products. It's actually a human product, but I love them. I use them for myself. I use them for a lot of patients too in their binders, and they have different types of binders. Some, if we have a mercury issue, then I'll use a certain binder that's going to have higher levels of silica to bind to that too. So there's different ways to do it. I know that's a lot of information. It's not meant to
No,
overwhelm, but
it's great. And we love bentonite. We all love bentonite in this group. I use it a lot in horses, not so much in cats or dogs. I always feel like so much bentonite might be in kitty litter that they're probably already absorbing themselves to bentonite clay, but I could be totally wrong about that.
you're probably not getting enough though. Like, and it's probably going into their lungs instead of like their GI
Yeah,
tract. I mean, they
exactly.
groom it off of themselves, so I guess, but like, I mean, our litter doesn't have bentonite. So, I get it's it's something that's a great thing. I didn't even think of that, to be honest.
I
But
always think of that. I'm always like, I think cats get plenty of bentonite if you're using a bentonite based litter,
But if their
but
kidneys aren't working well, or they're like eating dry food diets, like they're all dried out and dehydrated. So, we've got to
True.
flush that out too. I'd be looking at, and it just depends. Once again, it's like, this is not, do not go and like heavily detox your pet because without understanding why you're doing it, because we also need to make sure we have all those nutrients, or else this is where we run into detox reactions and pets don't feel good, and I don't want people to end up in the ER, so something to
Well, and
just be careful with.
I love how so many animals are allergic, but it literally could be a toxicity or a deficiency, and nobody looks at that. So
No, the majority of when people come to me, and well, I deal with gut and skin issues, and I'm like, I look at their diet and I'm like, you fed scrambled eggs for like months. Like, that hot spot is not an allergy. That hot spot is a nutritional deficiency. And we need to heal that gut, and we need to start really slow because your pet is sensitive, and we need to do a hair tissue test, because is there a heavy metal problem that's blocking that? But there's a way, like, you don't just start by adding all the things. You've got to work slowly, building up in a certain way with a certain framework. But yeah, nutritional deficiencies are really common. And two, it's because we're not digesting properly. So, I mean, that's a whole nother thing we could talk about, is the digestion and, the physiology behind that, and the enzymes and the stomach acid. And, so many pets are just not digesting properly. Microbiome issues.
Can you please be my new doctor?
I know.
I will be a good puppy, I promise.
I know. I know. I agree.
and Christy's asking, are there horse tests or where can you get them? Do you know any
I think you
company?
can do horse tests. I'll take a look at ARL. The only problem is that actually Ava Frick may do horses with her
Okay.
hair tissue test. I'd look at Dr. Ava Frick's website. I think it's just avafrick.com. She may do horses. So take a look at her website. With the human side, ARL will run, like some of my clients will run their hair samples. And I'm like, I'm not interpreting this, but they will actually create a report for you and recommendations with food and supplements. So, which is nice. But there's a lot of human practitioners that do hair tissue mineral testing. So you could
Now,
always
are
work
you
with a human
living, you
practitioner.
live in Colorado or Florida?
Colorado.
Very cool. So Julie's sister is in Colorado. She's like, Poppy, if you fly, she messaged me during your thing. If you fly to Colorado, maybe we can all get together. I'm like, sold for
Awesome.
everybody.
Let me know.
That's
We're gonna
awesome.
say, Poppy, are you going to the Nautical Dog Expo in July?
They sold out. I
Oh,
didn't.
I know they
I'm
sold out
always
in like
late.
10 minutes. I know. It's like,
I'm always late to the party. I'm always like, what am I gonna do in July? And then it's like sold out.
yeah, I don't know. That was crazy. It's Karen and Rodney. So
I saw Rodney at the feed reel, and that
oh,
was,
awesome.
yeah, that was
Yeah.
good. And you have your feed reel certification.
I haven't I've done the program, or I've like
Oh,
went through it. So Case Stewart was my pre-vet advisor at Notre Dame. I don't know if
no
anyone here knows Case
way.
Stewart. She works with Feed Real and she does a lot of the education. She put together the program and just like full circle. She is the reason why I'm a vet. So
Wow.
I worked with her at Notre Dame in the lab. She was part of like the lab animal side, and I worked for her when I went to undergrad there. And then I did my pre-vet stuff with her. And she's the reason why I found out about New Zealand. I went to vet school in New Zealand. It was accredited. So it was like going to CSU, but just in a really awesome place. And yeah, so Kay Stewart, if you ever meet Kay, thank her because she's the reason why I'm a vet.
Kate is so humble. You would never ever know. She just looks like somebody that's just like hanging out studying stuff.
Yeah, she's
I had
an
no
amazing
idea.
person. She's really nice. So,
Oh my
and very
goodness.
intelligent.
Incredible. That I had no idea.
Small
Now I
world,
have
right?
mad
She reached out
respect.
to me, I think when she first started with them, and she's like, I hope you remember me. And I was like, how could I forget you? So
It's so
yeah,
sweet.
I love it. I love it when everything comes back around and it's just the coolest thing ever.
Well, and Ruby is an amazing woman. She really is honorable.
Yeah,
She does
she
everything
is.
with
She's really,
quality.
yeah, she's we're so honestly like all of us here, including everyone listening, like we are so blessed. Like our community, the holistic community for the most part is just like made up of the most amazing, like there's like just the energy, the light. Like I just it's so amazing because it's not always easy. It's not easy for us on this side too, kind of trudging through and trying to create this change that we all wish to see. But when you connect with everyone, like these community is so powerful and so important when you're like on this mission. So it's so nice to just be around such amazing people.
Well, thank you, Dr. Katie. It is, you guys, there's a few of you who are just joining live. I'm going to say you missed it. That's all. You just missed out, but you get the replay. So that's all great.
Awesome.
And so thank you for your time. Any parting words from anybody else?
You know, thank you so much for having me here. Thank you, everyone, for taking time out of your busy evening, day, wherever you are, to learn more. I think the biggest thing is, like I said at the beginning, keep asking why. Like, why is this happening? Why are we using that? Why am I thinking of using that? It's really changed my life personally from a health perspective, but just in general. And keep an open mind. I think that's another key thing too, is just keep an open mind with as you learn, as you go through life, hearing the other side, it's not always easy, but keeping an open mind and being kind and empathetic is going to get us to where we need to go with this mission that we're all on together.